President Biden has launched aggressive measures to fight COVID-19. The action plan includes vaccines in some workplaces and also in healthcare facilities that accept Medicaid and Medicare. He also wants to make rapid testing kits more available to health centers and others. And he says his patience is wearing thin about the unvaccinated. What he had in mind is places like Mississippi, which is dead last in vaccinations and number one in deaths per capita from COVID-19. With us today are two health center leaders on the front lines of fighting COVID in Mississippi. We are joined today by Terrence Shirley, the Chief Executive Officer of the Health Center Association of Mississippi. We also have Tara Gallion, a nurse with the Delta Health Center in Mound Bayou, Mississippi. We're reading in the newspapers now, Mississippi is number one in deaths per capita right now in the nation, and has, I think it's dead last in vaccination rates. So tell us a little bit about the factors that are driving the upsurge in the Delta variant right now.
Our political climate is at odds with the medical community in Mississippi. And Mississippi has not adopted a mask mandate for general community or in-person teaching and student. For example, football games are crowded, and you can just see that there are no masks in the crowd. So we look at that as one of the super spreader events that we're facing, particularly with two SEC schools in the state of Mississippi, and they are jam-packed. Efforts to encourage vaccinations through mandatory policies are perceived as an infringement upon the rights of a lot of people here in the state of Mississippi. And this impacts the ongoing hesitancy campaigns and minimizes participation at our ongoing vaccination events. The Mississippi State Department of Health, community health centers, pharmacies, and pop-up clinics are readily available to administer vaccine at no cost to the recipient. But we're still fighting that battle of, I'm not going to mask, it's my right, and you can't tell me what to do. We're going to have to just keep educating our people, and just regardless of what the political climate is, we're just going to have to stand firm and recognize that we're just going to have to keep beating the bushes, going to have boots on the ground, and we're just going to have to just fight against the negativism, and hopefully we'll get a breakthrough that's not a COVID breakthrough, but an intellectual breakthrough.
Well, the thing about it is each one teach one. So we educate all the patients that come here and all the ones that we interact with, even if you go to the grocery store. But now we have Denise Taylor, who we call Coach T, and she has been on several different news outlets, and she's one of the ambassadors. So she's going around to different communities and talking to different people, coaches, pastors, teachers, anybody that she can interact with, and she's explaining to them and telling them the significance of actually getting vaccinated, because it's not that bad. I know a lot of people have questions about whether or not, hey, it's going to cost me to do this, it's going to cost me to do that. And I was like, no, and then she educated them too. So one thing about we stay on top of what the CDC is saying, and we read and do our research. So when we go out to our patients and we talk to them, we are able to explain to them the importance and what the vaccine is here for. And we also tell them that it's not a cure, but it's something to help your body to fight against it if you ever were to get it. It's just like the flu vaccine. It's not to prevent you from getting the flu, but if your body was introduced to it, it would help your body to fight against it.
Do you find that misinformation is a challenge? Like, what are some of the common reasons that you run into for vaccine hesitancy?
That plays a major role because a lot of people are on social media, Facebook, Instagram, and everything. And they listen to a lot of the misinformation saying, oh, when you get the vaccine, you become a zombie and it has lead in it. And they talking about putting quarters and stuff on it. And I told them, no, that's not the truth. The thing about it is it's a vaccine that's here to help us, just like all the other vaccines, polio, measles, mumps, rubella, everything is here to help us. So it's something that's not going to prevent you from getting COVID, but it will help your body to fight against it. And we emphasize and stress that importance to them over and over again, and just tell them that, you can't listen to the media because a lot of times the people on this different social media platform, they've already been vaccinated and they just trying to see how many likes and dislikes and stuff they can get. So the best thing to do is that you do your research and you talk to your family, your loved ones, and then figure out on your own. But we do push and emphasize the importance of it. And if you look across the board, that's the new norm, because if you plan on traveling anywhere, you're going to have to show a vaccination card. So we tell them that, if you have any discrepancy or any questions or something, feel free to call us. I mean, we're here every day, Monday through Thursday from 8 to 6, Friday 8 to 12, and we open on Saturdays. So if you have any questions or you just want somebody to talk to you, then we're available to talk to you and educate you and explain the significance of the importance of the vaccine.
The moment the virus became politicized, conflicting messages began. People began listening to the politicians as opposed to listening to the research, listening to the science, listening to the medical communities. Decisions to trust the vaccine is often made based on political affiliation and not based on the scientific proof that vaccines are safe. We're attempting to counter that misinformation with our website, with ads, we've employed a community health worker to be the boots on the ground in the community to also help in that regard. We don't know where it got to be that these home remedies were going to be something that should be injected, and it's just tough. It's frustrating to say the least. And for those by not believing the science and not trusting the CDC and the FDA and the medical community is really an uphill battle.
And tell us how this is affecting your ground game. I'd like to hear more details about that. You said you have a boots on the ground effort. You're hiring community health workers. Tell us more about that. Are there partnerships?
We are partnering with churches. We're partnering with other organizations, profit and nonprofit organizations. We're having drive-through events. We're having giveaways of PPE, and at the PPE drive-throughs, we're actually offering vaccinations at that particular point. We have staff that go out, not only just community health workers, but we have staff that go out and actually do training events and educational events across the state in an effort to bring down some of the health literacy or improve the health literacy of some of our residents in Mississippi. We're on call, and when someone calls and asks, "Can you participate?" We pack up and we go, and we do whatever we can to be there for not only the community health centers that we represent, but also any other organizations calling asking for our assistance.
Also, we are actually going out and setting up tents. I mean, we were doing tents when we were doing COVID testing. We're doing tents when we are doing COVID vaccines because we're making it accessible for everybody. So just in case you don't have transportation to us, we're coming to you. And we also have a partnership with the Mississippi Transportation Department that they are actually picking up patients and bringing them to either of our 19 sites to get vaccinated. So we're making ourselves very accessible for anybody, anytime. And then, like I said, we're doing vaccines almost every day. Every site is doing vaccines.
You know this community, you know this state, you have long-standing ties in this state. What does your gut tell you about what's working? I mean, and particularly with health centers as sort of trust ambassadors.
Well, the local community, particularly the smaller communities where the health centers are, they trust the health centers. And it's the larger metropolitan area types where the large populations that are not necessarily community health center users are actually being negatively impacting what we're trying to do with the patients that we have access to. It's really one of those that, I want to say this politically correctly, it's one of those where we're going to just have to understand that those that are against the vaccine, unless and until someone in their family actually contracts it to where it's really, really severe and or they lose someone, that is really the only way that we're going to start getting the masses to the non-vaccinated, the unvaccinated, and those that are against vaccines to say, I'm willing to step up and take it. And not only take it, they have to admit that they've taken it. You have closet takers that they've taken the vaccine, but they're not telling people. And they're not telling people because they stood up so firmly against it in the past, or their political affiliation is saying you better not do this, whatever the case may be. But yet they're protected, but they're not telling you they're protected.
The biggest problem I think that we facing is trust. And I think more likely when you build that rapport with your community leaders or just people in the community, period, then you can persuade them to come and get it. And if you tell them that, hey, I got it, and I did the research and this data and stuff out. And if, like I said, if you have any questions, we're here to answer to the best of our ability. And I mean, a lot of people just really terrified of needles. I mean, that's just it. I'm a nurse and I don't like shots. However, I'm pretty good at giving them. So the thing about it was I wasn't really reluctant, but I just don't like needles because I've had bad experience before with sticks. But I knew that it wasn't about me. I thought about my family. And that was the main thing about it. I had to protect them. So in order for me to protect them, I had to get the vaccine.
What was the hardest thing for you personally, your hardest challenge in dealing with COVID?
The hardest part of COVID was to actually try to get patients to come get vaccinated and they just refused and then they got sick and they passed from it. That was by far the hardest right there because it was some people that were really, really close. And I thought we was on the brink of actually encouraging them and getting them to come and get vaccinated. And when they say, oh, I'll see you next week. And then the next week, they're in the hospital with COVID. And then after that, they passed from there. So that was by far the hardest. And we emphasize and we stress that all the time. I want you here. I need you here. Your family need and want you here. And I tell them, I say, you have to look beyond yourself. So it's hard to deal with stuff like, situations like that, the loss of a patient that you've been knowing for years. I've been at Delta Health Center for 10 years. So I know quite a few of the patients here, their families, their loved ones, significant others and everything. When I walk through the lobby, I call everybody by their name and they just look like, how you remember my name? It's easy because we've had conversations. But to actually try to get someone, encourage them to come get vaccinated and then they just refuse. And then a couple weeks or so later, you find out they're in the hospital with COVID, and then you find out that they didn't make it. It hits really, really hard because you always thinking to yourself, what could I have done different? What could I have said different that would encourage them to come? So I use those examples right there to try to encourage our other patients the importance of this. Because if you leave here, then who's going to be here to take care of your loved ones?
You and your father, Dr. Terrence Shirley, are veterans of the struggle for equity in healthcare and pioneers in the health center movement. And he was indeed a visionary in when it came to fighting for equity and addressing racism as a social determinant of health. If he were alive today, what would he observe about the pandemic and the glaring health disparities of COVID?
He would observe that the same political determinants of health, i.e., the lack of Medicaid expansion, the lack of adequately funding school systems, the political gerrymandering of districts, the general lack of not caring for those that are less fortunate continue to be the forces behind the social determinants of health that we're recognizing now and that COVID exposed. He would also observe that COVID pulled back the curtain on the fact that racism is still very, very deeply rooted in this country. And we still have a very long way to go.
Are you seeing encouraging signs that vaccinations are picking up?
Vaccinations are picking up. I think the Delta variant drove that. When prior to the Delta variant, it was lagging. But once the Delta variant hit and they realized that it was not just the population that was over 50 that was being really decimated, when they started realizing that younger and younger people were getting more affected, and actually transmissibility of the Delta variant is more severe than the original COVID. And we believe that was one of the driving factors that improved our vaccination. It told the story for us.
Well, from the field and as we're here at the main site, we're getting a lot of people coming in now. I mean, people come to get the first dose, the second dose, some even coming in for the booster shot. So the numbers have actually increased tremendously, because they know that we're here to help them as much as we possibly can. And we emphasize and stress to them the importance of the vaccine. And everybody here at Delta Health Center, all of our sites have got vaccinated, as well as our family members. And we just stress the importance of that. So we are using our game plan. We are on the ground. We are marching. We are advocating to get this vaccine.
Are by and large the staff at your facilities, at your sites, vaccinated?
Yes, everybody at the site has been vaccinated.
Everybody at the Delta Center has been vaccinated?
Every clinic has been vaccinated. Yes,
well, that's good to know. Wow. And was that a requirement, or is that just everybody was incentivized to do that?
Well, we knew that we were serving the public, and how can we be their advocate if we're not vaccinated? So that's one of the main things that we emphasize and stress, that in order for us to push this vaccine, the importance of it, that we have to be able to tell our patients face to face, hey, I got it and I'm still here and I'm not a zombie. So that's one of the main things. And like I said, the important thing was, how can we serve our public if we're not getting vaccinated?
One of the things we understand is pediatric cases are one of the fastest growing in the state. Is that something that's affecting your ground game now? Are you reaching out to families,
Absolutely.
generations?
Absolutely. And again, the variant drove that information for us to help. We obviously don't want the variant, but because they started realizing this is actually hitting a pediatric population. I mean, the hospitals are full, and there's only one children's hospital in the state of Mississippi, and the only level one trauma center. So when you start looking at the capacity as a state, the pediatric population, we're really worried that we won't have that capacity because we only have one children's hospital in the state of Mississippi, and that's in Jackson. And everybody can't get here. And not only that, then they don't have the capacity to continue to have to fight this surge.
The Delta Health Center was one of the first community health centers in the United States. 55 years ago, it started in Mound Bayou, Mississippi. And so you guys were the precedent centers, I guess, setters in terms of being the very first. How does that make you feel working there? Do you feel like you're doing something really special in terms of a sense of mission?
Yes, I do. I feel very, very proud. And I scream it from the rooftop that this is the first FQHC ever established in the United States. And it started right here in the little town of Mound Bayou, Mississippi. And I mean, we emphasize that, we push that, and we encourage people to come and see us. And that this is the beginning. This is where everything started from. This is the foundation. And from here, everything else has grown. All the other FQHCs across the nation have grown from here, Delta Health Center in Mound Bayou, Mississippi. So we take great pride in it. We emphasize it, and we actually try to educate our patients and let them know, hey, it started here in Mound Bayou at Lempton Street Church, where they saw the very first patient was seen at Lempton Street Church here in Mound Bayou. So, I mean, that's just enough right there. We're part of history.
The Delta Health Center was the first community health center in the United States. It was out of Tufts University, and my father was one of the people that helped found that community health center. We actually lived in Jackson, and he was commuting back and forth to Mound Bayou, which is about 150 miles away. But I would always tease him. He talked about, everybody talked about what he had done, but my mother was actually from Mound Bayou, and he had no choice because she made him go to Mound Bayou. And my brother and I loved it because we would ride up there with him and stay with my grandmother. And we would go for safety reasons, for his safety reasons, because back in those days, it was dangerous for him to be driving those highways late at night. So we would go with him as we rode shotgun with him, literally. And we would go and stay and then come back with him. So we would do that during the summer. So yeah, Mound Bayou is a special place, not only in the community health center, in my heart as a community health center, but in my heart as a town.